Hi, Dr. Shauna Rupel here, Girl Next Door OBGYN. I wanted to come on and talk a little bit about sexually transmitted infections. So we used to call them STDs. We now refer to them as STIs, sexually transmitted infection versus disease. And we've seen that likely because of the pandemic, rates are increasing in the United States. We thought initially that these rates would start to decline as we kind of started to resume back into many of our normal activities, but we have seen that the rates have continued to climb across the United States. It seemed that what likely contributed to this in the beginning was an increase in drug and alcohol use associated with the pandemic, lack of access to health care, and delays in treatment because of that lack of access. So if people weren't going to the physicians, they weren't getting treated, and then disease was spreading much more quickly. However, we've noticed that now that we have better access to healthcare and people are able to get into their providers' offices a little bit more easily, we're still seeing an increase in STI rate. This is very concerning because of the risk for continued spread, because many of the diseases are undetectable. So many people don't have any symptoms. You can spread infection unknowingly to others with unprotected intercourse. So it's very important that if you have more than one partner, that you use condoms to protect yourself, that you get screening if you've had additional partners, and that if you have any symptoms at all, you make sure that you reach out to a healthcare professional. One thing that's pretty concerning is that we've seen an increased rate in syphilis, which in many parts in the US had been pretty much eradicated, meaning we don't see it anymore. But those rates are also increasing. And in obstetrics, it's very concerning because we see increased rates of congenital, meaning passed on from mom to baby infection, and increased risk of stillbirth associated with those syphilis infections. So this is a problem, these increasing rates. It's not true that if you have a sexually transmitted infection once that you are never going to be susceptible to get it again. It's not true that if your partner had a sexually transmitted infection that you would know it, that there would be some type of symptoms. And additionally, it's really important that you consider getting retested after you initially get treatment, because it's really common that antibiotic resistance is increasing across the US. So the initial treatment might actually not be effective for you, or if you end up having sex and being re-exposed prior to the infection being completely cleared, you could get exposed to that infection again, and it can cause long-term damage, issues with infertility, issues with scarring and pain, chronic pain for the rest of your life. So it's really important that these are addressed